CaliforniaCare again. Today we are going to make you another presentation on how to deal with radiographs, how to develop them and what the components are. So we'll go through one thing at a time and hope you enjoy it and share it. Film, we have different sizes, film 0, 1 and 2. Normally for adults we use 2, and these are pediatric film samples. You got to realize the part that is normally colored is a part that you don't expose, you expose the other part. And the part you're going to expose is going to have a little pimple on it, and I call it a pimple because it's a bump that comes out of the film, and you can feel it by running your thumb on it. Now when you have this bump, you need to know that this needs to go on the occlusal surface of the teeth. So if you're taking a radiograph of the lower teeth, then the bump goes towards the occlusion. If you're taking the radiograph of the upper teeth, then the bump needs to be down here. But the white part, generally the smooth part without any opening film components, is the one that faces the teeth on the inside, and then you shine the radiation on the outside. But if you were to take a film and open it up, you got to know the components that go into the film. This is the plastic part, which is called the plastic cover. You dispense it and you throw it away. Then what you see inside is a little piece of lead foil. Okay, and then you have a little piece of paper wrap, which is a capsule paper, and it opens up and encapsulates the whole film. All of these things get discarded. The one thing you have to be worried about is the lead foil. It needs to be kept so it does not contaminate the environment, and you don't touch it with your fingers too much. And now you have a film, and hopefully you'll open this film, which has already been exposed in the patient's mouth, and you open it in a dark room with only red light. Again, you feel the bump right there. So on one side you feel the pimple, on the other side you feel the dimple. It's kind of easy to remember. Dimple is with the depression, and the pimple is the spot that comes out. Now we have developing clip. The clip also has a pimple and a dimple. The part which is pointed is a part that needs to go into the dimple, the depression. And you have to be careful. If you place it the other way around, then you lose the orientation of the film. Then once you have mounted it on a clip, you take it first into a developer. What the developer does, it develops the image that you have exposed. A fixer only fixes what you have developed. And you also keep some water in between. So you put the film into the developer. Of course there is none here because this is not a dark room, but we are just giving you a simulation. And you constantly agitate the film. Even in automatic developers, they have agitators inside, and the film is agitated and the fluids are agitated. And you make sure it's completely dipped, and you don't let it touch the side of the containers, because if you do, then that area of the film is not going to develop and it's going to look dark, or it's going to look purely white. Once you have developed it for a few seconds, you're supposed to take it out and take a look at it directly with the red light behind you. If you can see the image of the tooth, then the image has been developed. You cannot look at it up towards the light source because it has not been fixed yet. So the first key is, as you're developing, take it out, take a look. See if you see the image, then you develop it a little bit more. Once you're done with that, then you wash in the water to make sure the developer that's stuck to the film does not contaminate the fixer. So you wash it and then you put it in the fixer, agitate for a little while, and then you can leave it there. Hypothetically, you can leave the film into a fixer for the next 2 years and nothing will go wrong with the extra image that you have, because a fixer can do nothing more to the film except fix the image that was developed by the developer. At this stage, if you cover the developer and you turn the light on, image quality is not going to go bad at all. So if you bring an image out and it is not transparent on the X-ray view box, that means it has not been fixed fully yet. You can go back and dip it into the fixer and leave it another 2 or 3 minutes. But the key would be, you take it off and you wash it afterwards also. Maybe in a separate running water instead of in a beaker. What that would do, it would remove the fixer solution from the film so it does not leave brown spots. In today's day and age, what you should do is then take this and you remove the clip, and you still have the pimple and the dimple, and you know dimple is the right side, and then you place it on the X-ray view box and use your digital camera or your cell phone to snap a picture of it in zoom mode without the flash. Then you can transfer it to the patient file in the computer, and you can enlarge the image as much as you want and get to take a look at it. That's all there is to it. Thank you.